So what has happened during the pandemic is that many of the companies that produced vaccines had to shift some of their production lines for routine immunization towards production for COVID vaccine. And that has, let's say, from 2021, let's say, when the vaccine was started to be manufactured, has of course shifted, let's say, the global availability of some of the vaccines. Of course, we are coming out of that situation now, and so it is important that countries reinvest in accelerating the immunization towards immunization coverage. WHO has been working, and I think around 20 countries have been identified as priority countries to look at bringing immunization coverage back up to where we were before the pandemic. And this, of course, links very much to what I highlighted around the increased number of children from 19 to 25 million by 2020 that didn't have either a single or not all of their doses of immunization. So I know that the Ministry of Health in Ghana has made arrangements, and I think vaccines are coming into the country to allow to recapture, let's say, some of the losses in immunization coverage.
And for instance, some of the multilateral platforms available to us that are supposed to extend help to us through, for instance, Gavi. In the context of Ghana, for instance, we understand that that help will no longer be available for us in the coming years through the grants and support schemes that we get. So how do we approach some of these issues? Because the potential that it may affect the universal health coverage will definitely come up.
So I think in relation to Gavi, there has been an extension for Ghana to still benefit from the support from Gavi, and what Gavi of course provides is that it has ensured that vaccines are available at a much lower cost for low-income countries in order for them to be able to introduce it. And this is a huge advancement in equity, I think, because every child globally should have access to the same vaccines in order to protect, let's say, itself from him or herself from life-saving or diseases, let's say. So this has been a tremendous achievement from a global public health perspective. Now, Ghana indeed needs to look at how to finance, let's say, 100% of their vaccines after a couple of years. The Gavi support is still going on. But of course, Ghana has made tremendous progress because the way that Gavi works is not that you benefit from vaccines up to, let's say, 2023 or 2024, and then you pay 100% of the vaccines. What happens is that you slowly start co-financing the vaccines. So Ghana actually already pays for most of the share of the vaccines that are coming through Gavi to the country. So it's going to be a little additional investment that the government needs to make, because Ghana has been one of the front runners, let's say, in benefiting from the Gavi provided schemes. So the immunization program here has been very strong. Ghana introduced many of these vaccines already in 2005, 6, 7, 8, and has been co-financing those over the last years. So I think there will still be a challenge for Ghana, but it's going to be a small additional cost to what Ghana has already invested in the immunization program.
And the good news is that we're part of this network for improving quality of care. We'll talk about the opportunities it presents to us, but apologies for being fixated on Ghana because we're here.
Of course.
Cases of measles that we're reporting in parts of the country, for instance, these are obviously matters that threaten the attainment of the country-specific targets, isn't it?
Yes, yes. Measles is a very infectious disease, and we have seen measles outbreaks increasing globally. Sorry. So with that reduction in coverage, what we see often is that we need to organize some kind of catch-up campaigns to find the children who hadn't received the measles vaccine earlier. Indeed, measles outbreaks highlight that we have a group of children who have not been vaccinated, that coverage is low, and so it is important to catch up and address that.